Good morning. This is Ms. Kofke. We are going to be talking about standard precautions today. So this information is not new to you. This was all part of your core orientation. You probably went over a lot of it in your CNA program, but it is so vital to reducing nosocomial infections or passing infectious disease processes to other patients that are in the hospital, or to yourself. So we're going to go over standard precautions and the guidelines for it. We will be using the CDC as your most up-to-date as far as guidelines for different infectious disease processes. We will use the Centers for Disease Control as our most accurate and up-to-date resource. The link to the CDC website is on your module. There is also a table 21.3 in your med-surg book that goes over standard precautions. So what are standard precautions? They are the precautions used in the care of all hospitalized patients, regardless of their diagnosis or possible infection status. It is the belief that all body fluids, excretions, secretions, and tissues are potentially infectious. So we're going to expand past that, and we're not going to use standard precautions for only hospitalized patients, but all clients that we're going to care for. So long-term care facilities, in clinics, anywhere where you're going to be caring for clients, we're going to use standard precautions. So with standard precautions, it applies to anything that may be infectious. So blood, body fluids, secretions, excretions, the skin, the mucous membranes. If you're coming in contact with anything that may be infectious, you're going to be using PPE as needed. The CDC guidelines for standard precautions also address hand hygiene. So when should we wash our hands and with what? When should we wear our non-sterile gloves? And should it be every time we're assisting the client? So hand hygiene should happen before entering the room and upon exiting the room. All interactions before, after, and as needed. You can use alcohol-based hand sanitizer unless your hands are visibly soiled, which hopefully they aren't, because hopefully you were wearing gloves if they were going to get soiled. And then also we'll talk about other situations where you do need to use soap and water later in this PowerPoint lecture, but you can use alcohol-based products or you can use soap and water. As far as every time you go in to care for your client, so thinking about when you're doing your assessment, do you need to wear gloves every time you're doing your assessment? You need to wear gloves if you may come into contact with blood or body fluids of any kind. And that might include the skin. Your patient, you might not be able to look at your patient and tell that they're diaphoretic. You might not be able to look at them and tell that they had, when you're doing your neck assessment, that they had drooled all over and had oral secretions down their neck previously. So it is a good idea to just go ahead and protect yourself and wear gloves. Is it sometimes hard to tell if somebody's skin is warm or cool to the touch if you're wearing gloves? Sometimes. Is it hard to find pulses sometimes in gloves? Sometimes. So if you need to take them off and maybe, feel that skin, you couldn't tell if it was warm or cold, find that pulse, as long as there's no body fluids or any reason that you would need gloves at that time, or if you can look at somebody's skin and know that you can touch them without putting on gloves, then that's fine. Just make sure you use proper hand hygiene after. So we will wear PPE as needed. It might not just be gloves. If you are at risk of getting splashed or spilled or exposed to any kind of fluid, if somebody's coughing a lot, if you're going to be irrigating a wound and that could splash up, emptying a catheter, emptying a drain, anything like that where you may have splashback, you need to wear goggles. You may want to wear a mask with goggles, face shield, gown even. I have cared for patients that were having very loose stools, and when I was changing them, we would fully gown up because there was a splash risk. So anytime that you think that you may come in contact with any blood body fluids of any type, use the proper PPE for that situation. So with coughing, the CDC suggests coughing, sneezing, teaching your clients to do that into a tissue. There is a link to a Mythbusters video you can watch if you would like on your PowerPoint that talks about the different effects of sneezing and coughing in different ways, whether it's tissue into your elbow. We will teach our clients to cover their mouth and nose. That's harder when you're dealing with pediatric patients or confused patients. We will offer, you can offer masks. You can wear a mask if your patient's coughing and coughing and coughing, then you may want to wear a mask even if they don't have an infectious process going on, and that's okay. You can offer a mask to the patient or the family members. And then the standards for CDC guidelines for standard precautions also covers environmental and laundry textile care. So making sure that air, cooling, and drainage systems are appropriate, how to clean medical equipment, how to clean up spills that have happened, how to clean laundry. So make sure that whenever you do the laundry, and a lot of places have laundry chutes, make sure you tie the bags before you put them into the chute or into the laundry system, whatever the hospital system is. Standard precautions also cover safe injection practices, because if we're protecting ourselves from blood and body fluids, that includes the use of our sharps and not and trying to prevent sticks. So never recapped use needles. I'm sure you have learned that in pharm. Use sharps containers, not trash cans, whenever you are using needles. Use single dose vials when possible. So when we talk about single dose vials, what we mean is when you draw up medication out of a vial, let's say like insulin, we will use single dose vials as much as when possible. So things like if you were giving your patient 10 milligrams of, that's a lot, 2 milligrams of IV morphine, and you were pulling up that morphine, you wouldn't want to use, and it was let's say it was a 10 milligram vial, you wouldn't want to just pull up 2 and then leave that there for the next patient. We want to use single dose vials so that they stay clean. You do see multi-dose vials, what you see the most is insulin, and those don't go into patients' rooms or anything to get scanned. It's usually done all outside of the room. So insulin is typically the only thing that you'll see as a single dose, as a multi-dose vial. Use disposable, and we don't reuse needles and syringes inside the hospital. And then if at all possible, we will assign patient rooms carefully and try to make sure that people who have any type of infection-based processes going on, that they are in a private room. And it may be required that they're certainly distanced, but that would be something that needs to be considered, as patients with infectious processes need to be in private rooms. So transmission-based precautions versus standard precautions is going to be used in addition to standard precautions. So these are this is used for patients with suspected infections with pathogens that can be transmitted in different ways. So we categorize them by airborne, droplet, or contact. And we have a few extra things that I'll also go into when we get there. There's a table in your book, in your med-surg book, table 21.4, that also goes over transmission-based precautions. First up, we'll talk about airborne precautions. So with airborne precautions, is for clients with organisms believed to stay suspended in the air for prolonged periods of time. Some examples of this is going to be tuberculosis, varicella, and rubeola. COVID is also going to be underneath this, but I'm going to address COVID on another slide, so just hang tight on that. What do we need and what do we do? So for a patient with airborne precautions, they need to be in a private room with negative air pressure. Negative air pressure means that the air is not being pushed out. It's not going out. It's getting sucked out of that room so that it's getting filtered before it's gone anywhere else. Where regular rooms, they're pumping air into the room, they're sucking it out of this one to where it's filtered before it goes elsewhere. The door needs to be kept closed. Appropriate PPE for a airborne precaution room is an N95 mask. This would need to be fit tested. To be able to wear an N95 mask, it needs to have been fit tested. Or if you don't have a proper fit, that you can wear a higher level respirator. So with patients with airborne precautions, a lot of times you may see somebody going in fully in gown and gloves and everything, the whole 9 yards. As we go through this information, what I need you to know is the minimum. And we'll talk about that again a little bit later, but what you need to know is the minimum. So for airborne precautions, what is required is an N95 mask or respirator, a fit tested N95 mask or respirator. We want to limit transport of these patients out of the room. We don't want to, if they have a chest x-ray ordered, we want that to be done inside the room. We don't want to push this patient out through the hallway, down on the elevator, down through the hallway to get to radiology. If it can be done at the bedside, we're going to do it at the bedside. If it cannot, like a CT or an MRI, we will have the patient wear a surgical mask because they're not fit tested. We're going to have them wear a surgical mask for transport. We will, as always, perform hand hygiene before and after entering the room. And when these patients are being assigned, we're going to be cautious of the healthcare personnel who may be susceptible to whatever the disease process is. And what I always think of with this is things like pregnancy and varicella. People who are pregnant are at a higher risk with varicella and should not take care of a client who has it, so or chicken pox. So if your client has that and you're pregnant, you'll probably end up being reassigned. You won't care for that client. Next up is droplet precautions. So droplet precautions are for clients who have known or suspected to be infected with an organism that may travel up to 3 to 6 feet in a droplet. So droplets are generated when a client coughs, sneezes, talks, or laughs. Some examples of this are RSV. You'll see this more when you go on your pediatric rotations, that they are on droplet precautions with the RSV. So with RSV, the reason it depends is because with children, they are not going to cover their mouths like they need to, and kids are nasty and they touch everything and they cough everywhere. So with children in pediatrics, you will see that they will be on droplet precautions due to the high likelihood of coming in contact with oral and nasal secretions. In adults, you don't see that as much. And so typically with adults, they are only on contact isolation. With mumps, pertussis, or whooping cough, bacterial meningitis, and influenza, these are going to be on droplet precautions. So these patients need to be in a private room if available. If not, they would need to be more than 6 feet separated. The door can be left open with droplet precautions, because think about with airborne, it's like with those particles are just kind of floating. They're so lightweight and they're floating around. Where droplet precautions, it's more like, here comes the droplets, and then they only go so far and they sink because they're heavier. So they won't go past that 3 to 6 feet, or they're not anticipated to. A surgical mask, again, similar to the airborne precautions, we won't transport these patients if we don't have to. If we do need to transport them, they need to wear a surgical mask. Visitors need to stay 3 feet away from the infected person and also should be wearing a mask. And you should also educate your client on respiratory hygiene and cough etiquette. If possible, teaching them to sneeze into a Kleenex, throw it into the trash, and hand sanitize after. Contact precautions are for organisms transmitted by direct contact with an item in the environment. So examples of these are going to be your multi-drug resistant organisms like MRSA, CRE, VRE, and these have to, so methicillin resistant, carbapenem resistant enterococci, vancomycin resistant enterococci. So that's what those stand for. It means they're resistant to the antibiotics that are typically used to treat them. Lice are also treated as contact precaution. Scabies, and with varicella, if you have open lesions, then you would also be on contact. So with the varicella, remember, it was an airborne precaution. So what's required is just that N95 mask. But if they have open lesions, then they would also need to be on contact. So you can be on multiple types of transmission-based precautions. With contact precautions, patient needs to be, again, in a private room if available. Long-term care facilities, you may see that they will not be able to provide private rooms, but they will need to keep those clients multiple 3 to 6 feet apart. We will limit transport of these clients if possible. Hand hygiene when entering and exiting, you would need to wear gown, gloves when entering the room. Throw PPE away when exiting. So it needs to be where you can throw your PPE away at the exit. You shouldn't have to go back into the room to throw your PPE away and then go back out again, or it should be at the door. With contact, it's not going to be the same as like if you had an airborne isolation where you need to be all the way outside of the room when you take your PPE off. Avoid sharing patient equipment and use disposable or patient dedicated equipment. So like blood pressure cuffs, thermometer, we would use single use, or not single use, but single patient disposable cuffs, thermometers, stethoscopes. And then there will be extra cleaning and disinfecting in these rooms between patients. So the CDC doesn't specify additional precautions, but most hospitals do have this in place for contact enteric precautions. So this is for organisms that spread by direct contact or contact with contaminated item in the environment, but it's not easily killed by alcohol-based hand sanitizer or foam. This is typically going to be diarrheal type illnesses, GI things, C. diff, norovirus, and rotavirus. You will need to, again, hand sanitize coming into the room, gown and gloves when you're entering, and then you would need to wash your hands with soap and water upon exiting. So it would need to be soap and water, not just hand sanitizer upon exiting. Discard your PPE when you're exiting, and then surfaces are going to have to be cleaned with bleach, not just regular cavi wipes. It would need to be with bleach-based cavi wipes or other hospital-approved spore killer in the cleaning solution. So lastly, we have advanced airborne precautions. So this is what we're using for COVID-19. Different facilities are going to call this different things. So at some of the facilities, Wake Forest Baptist uses the term advanced airbornes. I believe Novant does also, but I'm not sure. So advanced airborne precautions, Iredell doesn't use advanced airborne. What they have them on is just airborne and contact. So for advanced airway, or this is what the CDC is suggesting for COVID clients, needs to be a private room with negative air pressure. The door needs to be kept closed. Appropriate PPE is going to be that fit tested respirator mat or fit tested N95 mask or other advanced respirator. gown, goggles, gloves, full garb. These patients will also be limited, need to wear a surgical mask if they're outside of the room, but limited transport as much as possible. Hand hygiene when entering and exiting. So basically, just for the COVID-19, with the CDC guidelines is this advanced airborne, or a combination of airborne and contact. So goggles, N95 or respirator, glove, and gowns. So another thing we're going to cover, just because you may see it, but you'll learn more about it in the spring, is going to be protective precautions or neutropenic precautions. So these are for clients that have a low neutrophil count. With the other precautions that we've talked about, it's about protecting other clients and the nurse from it's about keeping yourself and other clients protected from catching this infectious illness. With neutropenic precautions, it's going to be about us protecting them and us not carrying things into them. They have a low neutrophil count, so remember, from immunity, they're going to have a harder time fighting off infections. So examples of these clients are people who are taking chemotherapy, who've received organ transplants and are on immunosuppression therapy, or other immunocompromised clients. So main things with this is making sure hand hygiene upon entering and exiting. Please protect these people. Don't bring in sickness. If you are sick, you should not enter. I mean, if you have even a runny nose, anything at all that is not completely normal, if you just don't feel right, you shouldn't be taking care of these patients, because what is a common cold for you, or maybe just a runny nose, may end up causing them to be septic and seriously ill. We will avoid collection of standing water, so no humidifiers or flowers. Really, the main thing, what I just want you to take away, is that we're protecting them. So hand hygiene, and you shouldn't be going in, not you or their family members, if there's any risk of illness. And beyond that, you will learn more in the spring. So as I said, remember with PPE and knowing these precautions, you need to know the minimum. We want to be cost effective. We don't want to contribute to the rising cost of healthcare. So the type of PPE you need depends on your level of precaution, but it also depends on what you're doing. So remember, droplet and airborne, you only need the mask, the appropriate mask for the situation, N95 or respirator for airborne, and a surgical mask for droplet. But if you were going in to do something where you may get splashed in the face, or where you're concerned about something getting splashed onto your scrubs, you would still also then wear a gown and goggles. So know what the minimum is, but also be aware of what you're doing and protect yourself. So let's talk a little bit about putting on PPE and taking off PPE. So again, this came from core orientation, so this should not be the first time you're hearing this. So when you are putting on your PPE, this happens in a certain order, which we have listed here, 1, 2, 3, 4. So first up, you're going to put on your gown. If you have a gown that ties at the neck, you will put it on, tie it at the neck, tie it at the waist. Some gowns you just put over your head and then tie at the waist. Next up, you will put on your mask. So you'll apply your mask to cover your nose and your mouth and your chin. Fit the flexible band of either your N95 or your surgical mask, depending on your client's level of transmission-based precautions, and fit that flexible band to the bridge of your nose and make sure it's a snug fit to your face. You will then put on goggles or your face shield covering your eyes, and then gloves would be the last thing. When you put on your gloves, if you're wearing a gown, make sure they go over the cuff of your gown. Key points of when you're wearing PPE, keep your hands away from your face. If you put on PPE, your hands are going to start, your face is going to itch every single time. You're going to have the worst nose itch of your life. Don't scratch it. Keep your hands away from your face. Don't touch every single surface when you walk in the room. You don't need to touch everything. If your patient's on contact isolation and there's things that live on surfaces, you don't need to touch everything. If you start touching a lot of things, go ahead and change your gloves. Put on some clean gloves. Change your gloves when they're torn or heavily contaminated. You can change your non-sterile gloves as many times as you need to while you're in a room. Perform hand hygiene before putting on and after taking off your gloves. So when you are removing your PPE, there are two different ways. It depends on if you're going to take your gloves and gown off at the same time or together. So this first list is if you are taking them off separately. This second list is if you're taking them off together. So first up, if you are taking them off separately, remove your gloves one at a time. Remember, that'll be your first step. Remember that your gloves, the outer surface is contaminated. The inner surface is clean. So when you pull off your second glove, put your fingers inside the cuff and peel it off so that your hands stay clean. Remove your goggles or face shield. Next, eyewear comes off second. Remove from the back of the head and lift and go forward. Away from your face. Don't grab your goggles like this. That's not good. And you've got dirty hands, so just don't do that. Back of the head and forward, sliding it away from your face. Next up is your gown. If it had ties at the neck and the back, unfasten those ties, and then with your hands, after you've untied it, touch the inside of your gown only. Roll it away from your body in a bundle and discard. You shouldn't be grabbing it from the outside and rubbing all over it on the outside. That kind of defeats the purpose. So use the inside, pull it away, roll it up so that just the inside is what's on the outside of it. And then last up, you will remove your mask or respirators. Grasp the neckties or elastic. Don't touch the front of the mask. Don't do that. Remove N95. And if you are in an airborne room, you need to be all the way outside the room with the door shut before you take off your N95 mask. You should not take off your N95 wrap mask while you're still in an airborne precaution or advanced airborne precaution room, because then you have completely missed the point and you've been exposed. Second up, if you have the gowns that kind of tear away and you are taking off your gown and gloves at the same time, you would pull from your hands, or you still got your gloves on, so pull from the front of the gown, tear away the ties, and then pull everything forward, grasp the front of the gown, pull it away from your body, and then you just kind of roll it all off. Keep the inside of that gown towards you, and then you'll pull your gloves off inside of that. Roll it up, throw it away. Next up, eye gear, away from the back of your head, away from your face, and lastly, your mask. Again, do not remove your N95 mask if you are in an airborne precaution room until you are outside with the door closed. Don't touch the front of your mask. Make sure you have a trash can outside of your patient's room if they're on isolation so that you can throw all those things away when you get outside. That concludes our standard precautions. If you have any questions, please let me know. This will tie in tightly with your infection content, and we will be doing some activities in class. You may email me or put a question into the discussion forum if you have a question. Thank you.